Hello, everyone. Welcome to Next Generation Healthcare, the VillageMD and Walgreens collaboration story. I'm Stephen Collins. I'm the CEO of Matter. We're a healthcare technology incubator and innovation hub with a mission to accelerate the pace of change of healthcare and a core belief that collaboration is the best way to do that. We do three things functionally. First, we incubate startups. We launched in 2015. We've worked with about 750 companies since then that are innovating in virtually every aspect of health and healthcare. They're located all over the world, and collectively they've raised more than $4 billion to fuel their growth. Second is we work with large organizations, health systems and life sciences companies and insurance companies to strengthen their innovation capacity and help them find and create value from the disruption and the entrepreneurship and innovation that's happening all around them. And we give them insights into how to think about technology in novel ways, and we help upskill them on becoming better innovators themselves. And third, we're a nexus for people who are passionate about healthcare innovation and healthcare transformation. We bring people together in forums such as this one to be inspired and to learn and to hopefully glean new insights on how health innovation and health transformation is really happening in practice. We also do a lot of small programs that are just for our members that really bring people together to connect with each other. We are very fortunate to have a relationship both with Walgreens and with VillageMD on different projects. We've gotten to know both companies as they've pursued very innovative models in healthcare. Walgreens has now invested more than $6 billion in VillageMD with a plan to co-locate many hundreds of Village medical clinics with Walgreens locations around the country, using a physician-led value-based care model that we'll get into and we'll talk about. And today for the program, we'll be joined by Mark Vainisi, who's the Senior Vice President of Corporate Development and Strategy at VillageMD, and we'll be joined by Anita Allemand, who's the Chief Transformation and Integration Officer of Walgreens Boots Alliance. We'll have a discussion about how the two organizations came to collaborate and what the next generation of healthcare looks like. Mark, Anita, thank you both so much for joining us. I'm looking forward to the conversation. And Mark, I will start with you since you've played, you've had roles in both organizations. You were at Walgreens and now you're at VillageMD. So I have to think you have at least some measure of involvement and responsibility for this collaboration. And how did this happen? How did this collaboration come to be?
Well, I think, and thank you for the introduction, Stephen, and nice to be here, everyone. I appreciate the opportunity to talk to you. I have been with two great companies in the last 17 years. That's when I started at Walgreens. And I think if you even take a step back before we get into how the collaboration started, if you think about Walgreens in the context of 15 years ago, what it was building and what I think it very effectively did build was the most efficient, best pharmacy chain in the country. It was building the best locations, serving the broadest population, the broadest segment of America, and trying to get to a level where it could provide convenient access in the most affordable way. So you had to get to a certain scale and you had to get to a volume. You had to have a really efficient platform that you could build on and then create these services and other offerings that you could then to build in that next generation of growth, that next generation of profitability. So my first 15 years, say, at Walgreens was focused on building up that platform. It's when we went international. It's when we went really expanded the retail footprint, participated in the consolidation of the industry. But once we had that platform, we said, how do we get to the point where we can really optimize it and position that platform to continue to be great in providing pharmacy, great at providing retail services, but what else could we do? And there were really two strategies that were critically important that led us to where we are today with the VillageMD, specific this collaboration. One was that what we called back then a neighborhood healthcare destination strategy, where it was a commercial, mostly a contractual relationship with a lot of different types of offerings, whether it was lab or urgent care, eye care, hearing care, a lot of things that we were testing and trialing. And one of those was primary care with VillageMD. And then the other strategy we had was building an investment portfolio to try to get some innovation from the outside in, bring it, there were certain businesses and, really interesting things happening outside of our core business that and I'm saying we here as though I'm still at Walgreens. The Walgreens didn't feel like it was positioned well to own, but wanted to get close to, wanted to understand what was happening. What was that sort of next generation or next level innovation, whether it was technology, care delivery, whatever it was. So we had these two paths. We had the piloting different services through the neighborhood health destination strategy, and then the investment portfolio. We made, in the investment side, we made investments in companies like Option Care, Bright Spring, Premise Health, and one, Shields Pharmacy, Shields Health Services, and VillageMD. And as we looked at the portfolio and the health destination strategy, we said, something's really rising to the top here. Something's really working. And VillageMD was, just caught our attention as a company that was very closely connected to what we were trying to build in terms of a healthcare offering that was all payer, all patient, relevant to the same sort of customer segments that were relevant to the Walgreens business. And there was enough sort of gas in the tank, so to speak, that it could become a really, really relevant player as the industry evolved. So we, on back to the Walgreens side, said, hey, there's something really interesting going on here, and it really connects with where we think we're headed. Let's get closer. And that led to an investment, which led to another investment, and then finally the bigger investment, as you referenced in your comments, the many billions that were invested last year. And on the Village side, what Village saw was an opportunity to really accelerate its mission of being able to become the most, as you look, and we'll get into this, I'm sure, in other questions, as you look forward and you try to become a solution in what is a fragmented, broken, difficult system to access. There's no better way to there's no better partner for a company like Village than somebody who has an incredible brand in healthcare, the access locations, the balance sheet, the support, the alignment culturally and otherwise, to really help us get from what we think is we Village think is this incredible idea that our founders concocted and a model that the market really needs. We needed a partner that could get it to scale and give us the ability to really have the impact that we know that our model will help us have. And that's so it's a very mutually reinforcing collaboration. And having been on both sides, I think it's it's still very much believe it's the right model, the right time, and it'll be really good for both companies.
So Anita, it's clear from the partnership, it's clear from what Mark was talking about, that Walgreens has a very intentional strategy around healthcare.
Yeah.
More, and maybe in addition to or as part of or whatever, the strategy could be going in different directions. I mean, Walgreens could be, hey, we're a pharmacy, we're going to really beef up our retail so that, that becomes a growth engine. And there's different things that the company could have done. It wasn't the first company, to really get into providing healthcare services in this sort of retail format, but is now really very much invested in that strategy. So I'm interested in your take on the strategy of the organization, but also interested on, you worked at Walgreens really earlier in your career for a short time, and then went on to have these, very senior roles at CVS and at Optum. And then, you come back in a very different kind of a role at at Walgreens, but I imagine the strategy is very different than it was 20 years, whatever it was, previously. Is this a company you recognize? You feel like, oh, I'm sliding right back in. I understand how this company works. Is it completely different now? And how does in the context of the strategy and what Mark was talking about, really focusing on delivering healthcare services, how does that all come together from your point of view?
Yeah, no, thanks. Great question or set of questions in there. And to echo what Mark said, thank you for having me. Great dialogue here, really to highlight the collaboration between the two organizations. So I'll start with sort of, my background and the question you asked me around how is this as an organization? You're right. I started as a resident, I'm a pharmacist by background, as a pharmacy resident a long time ago. And quite frankly, to be pretty transparent at that time, the focus was really around all the things Mark said. How do we become and how do we continue to become the premier pharmacy destination? And so that for me, it was, my path led me to different things, which is more in managed care. And as you said, in Optum. What was really exciting, I've been here a year, came into this role around transformation and integration, was last October when our CEO, Ross Brewer, really said, hey, we're a great pharmacy, but our next growth engine, the next lever really is how we expand on that, right? We've got the brand, we've got really the loyalty, but we need to become very, very relevant in healthcare delivery. We have to take what we've done in pharmacy and do really, really well and explore areas beyond that we need to. And that's really compelling for me, because I will say in many other organizations, I've sat on the sidelines and to Mark's point, this is a great organization. We have the breadth, we have the depth, we have the ability to really do a lot of stuff. And I'll walk through some of the questions around COVID and the huge impact that our pharmacists and technicians and the stores had in vaccinations and testing. So I would say this is really a great moment in which we are expanding into, different aspects of healthcare. So really, what's the strategy? For us, the vision, the North Star is to be the leading partner in local healthcare and well-being. And as I think about it, it includes really two aspects. One, as you always put the patient and the consumer in the middle, how do we really customize that healthcare experience and enable that journey across the entire continuum, right? How do we make quality care more accessible, more convenient, and really when, where, and how the patient and the consumer wants it. So we really start with a very consumer-centric focus. The second piece, as you think about healthcare, we've been to some extent in more of a transactional model, and we feel very strongly about moving that more to a longitudinal model. So how do we move from just delivering services, being fee for service, to moving into more of the value-based care continuum, where we're really, our services are based on performance, based on value that we can deliver. So this strategy fits really nicely. It's all about the consumer. It's all about moving more into a longitudinal relationship. And what better way to do that than with the partnership we have with Village, right? So we've had partnerships in urgent care, and that's important. I'm a mother of teenage kids. I know that sometimes I just need to go in and out very quickly, but this is about building relationships with the primary care physician, with an interdisciplinary team that really starts at wellness all the way across the spectrum for the family. And so for us, that strategy really resonated with who's the right partner for all the reasons that Mark mentioned, and our ability, quite frankly, to be able to go there beyond pharmacy. What are other sets of services that the patient and consumer expects, whether it's today or in the future, to come in to a convenient location and have those services performed for them, and driving quality and value-based care.
And how do you differentiate, how do you think about your healthcare offering Walgreens as a healthcare company as opposed to a pharmacy company or a retail company or
Yeah, so I would say, the things I mentioned, right? As a healthcare, our focus is what can we do to do a few things. One is reduce overall total health cost of care. How do we improve health outcomes? And what are the areas and what's our right to win in these spaces? So the example with Village on primary care is a great example. Primary care physicians are anchors for a lot of the things we want to do in value-based care. We really, as I said, we want to move across that continuum into full risk if possible. And some of the other sets of services and capabilities are, some of the investments we've made in CareCentrics. We think that post-acute care is a critical part of that healthcare journey. When someone's in the hospital, they're released. How are we coordinating care, the right place for them to go, whether it's a skilled nursing facility or their home, ensuring that everything that they need to be healthy at home is enabled. So that's a big part of our strategy. So if you think about the continuum, wellness and prevention, acute, chronic care, whether that's care management, disease management, moving further into the spectrum around specialty pharmacy, which shields the investment we've made, post-acute care, and really continue across that to say what are other capabilities and services, whether it's leveraging our footprint or doing it in a way that's very omni-channel, because consumers and patients want care delivered in multiple mediums. And so whether that's home, virtual, in the stores, in clinics, our goal is to really try and figure out how we bring together those capabilities and become, quite frankly, the partner of choice for health plans and health systems who can look at us as an extension of the capabilities and services they want to deliver.
Mark, let's talk a little bit about the VillageMD strategy, which was before the Walgreens collaboration, was somewhat of a different model, going out and working with lots of practices in certain communities. I think you were in 7 or 8 or 9 or 10. I don't remember exactly how many communities it had grown to before the Walgreens relationship started. But how does VillageMD think about its strategy and whatever shift may be involved in collaborating with Walgreens, and how does that align with the sort of North Star of VillageMD?
Yeah, well, I think it's a good question, and I know it's a very rapidly moving landscape, and our model, our approach has shifted. I would say if you just break it down to brass tacks and try to really simplify it, because that's what helps me. As I'm still, I've been here almost a year. I'm still learning in the learning phase of my career here. But I think our mission is very simple. It's to improve people's lives by effectively returning the power in the system to where it should be, and sanity to the sort of structure of care. And at its simplest level, we build clinics, we hire the right kind of doctors. Those doctors provide the right kind of providers, doctors, APPs, nurses. They provide the right kind of care and deliver the right outcomes to patients, more care to, a more focused care to maybe a smaller patient population, but really focused on delivering quality. And then you get into value-based arrangements because you are lowering costs, delivering outcomes, and improving people's lives. And if you do that over and over again, you can turn it into a very attractive model for your business, for your payer, for your partners in the system, and eventually for the patient. So fundamentally, our mission is to make it easier for doctors to provide the right kind of care and drive, therefore, the right kind of results that make patients happy. It's very we have 3 founders. One is a clinician, and he simplifies it. It's Clive Fields, Dr. Clive Fields, and he says it's just practicing medicine the way my father did. It's actually treating the patient as someone with a problem that needs to be solved, not referred. And not referred so that you can get your fee and get them out of your office as fast as possible, the way that the current system is designed. It's actually taking care of the patient, making it easy for that patient to access the system, and then providing better results for that patient and the people who are responsible for the payment mechanisms. And with Walgreens, we're able to do that in a way that says, hey, we were doing it in Houston, we were doing it in Phoenix, we were doing it in Atlanta. And the Walgreens partnership allowed us to do 2 things, with the capital that they provided the company, we could shift from an enablement model to primarily an employed model. So we had the capital to buy the practices and own the clinical element. It's clinically led, clinically independent. The doctors decide how to drive the care. It's not corporate led clinical protocols. It's all very doctor physician led. But by employing the doctors, and we can control the technology they have, the standards that they administer toward, and the integration of the whole scope of care, and we can provide tools that we couldn't otherwise provide, which gives us more control over the sort of the administration, not necessarily the care delivery. That's still physician led, but the administration, allowing us to have a broader, more we think a heightened impact than the affiliated models would enable. So the capital allowed us to have a more impactful model, and then the partnership allowed us to just scale much more quickly. And we now have the ability, unlike any other provider in our space, to serve all Americans. It's just a question of prioritizing the right markets and going at a pace that we both can handle. So we have an ambition to be the number one or number two healthcare provider in every major market, treating the most Americans, that more Americans than any other delivery system. And through the partnership with Walgreens, we'll be able to reach that goal much more quickly than we would have certainly on our own. So I think it's a very we're culturally aligned. We want to drive the right outcomes for the same patients. People don't appreciate this a lot about Walgreens, is nobody else serves all Americans. There are other retailers that serve certain segments. There are other care models that target MA or target Medicaid. Walgreens serves everybody, and they're in locations throughout America that reach everybody. They're in rural. They're in economically distressed area, all demographic situations. And that's our ambition, is really to become the healthcare provider for Americans in a very simple model that makes their lives better by empowering physicians and other providers to drive the right kind of care. It really is that simple.
Having gotten to know VillageMD over the last, 3 or 4 years, and a lot of the leadership there, and a little bit about what the company was doing, it has been it's always impressed me that there's so much discussion about and conversation about value-based care that's out there, and there's this transition to value-based care that we're going through, and shifting the way that care is paid for, and the way that risk is where risk sits in the continuum, and that VillageMD was really doing that and enabling that to happen in a very concrete, very sort of tangible way with this physician-led model in these different communities. One of the pieces of that I'd always thought was key to the structure was that you would negotiate with the payers in these communities. So you'd build this sort of critical mass of physicians and practices, and you were enabling them, and then you'd have these relationships with payers that would allow you to really implement value-based care. And how do you do that on a more national scale as you scale with a partner like Walgreens?
Well, I think you're never going to get past the healthcare is local, and payers make healthcare local when it's to their benefit to do so. So I think we do work with all payers, and we feel very good about our relationships with all payers, and work very hard to cultivate mutually beneficial relationships with our payers. And I think our payers very much like our model, because it's easy to see the results that we drive and the improvements that they see among their patient base. That said, we have to be worth their while in a market for them to pay attention to us. If we have 2 or 3 providers in a market with 100,000, they're not going to take the time to write the value-based contract that makes our model hunt. So that's another reinforcing element of what we can do with Walgreens is we can get into a market at scale much more quickly. You know, the rate, you can enter a market organically, you can enter it inorganically. We have to get to a level of relevance with the payers where they'll, where it's worth their while to contract with us on a more interesting model, whether it's, there's all the different variants of value-based, but we want to migrate away from the traditional incentives in the fee-for-service payment structure so that we can get into the much more value creating for everyone in the system value-based structures and constructs, because we really do believe the incentives in the current system are just not aligned. They're not the right incentives. The only way past them is to get into these other models. It's easier in certain segments than is in other, but where it's driven by the patient, by the payer, we're very focused on getting to a point of relevance to the payer as quickly as we can, so that we can get their partnership in building the future together in that market. Some of the national, we do think there's an opportunity as we scale in certain markets to say to the national payers, let's go into this market together. Let's, partner in a different way. But, the market, every market will be different, and every payer relationship will be different. I just think you're going to be in that healthcare is local mindset for some time still.
Yeah. Anita, how's it going? Are when you see early successes, what are the challenges that you see in the, next 6, 12, 18 months as you, with this particular collaboration, how's it going?
Yeah, I would say it's going well. Tremendous momentum. I'd like to think about success really in 3 parts. One is, scaling the model. So we started with what Mark said, right? 5 pilots in local markets, to now by the end of this year, we will have, 200 co-located sites. So that's the ability to scale at that level is a huge success. Now, certainly with that comes, growing pains and trying to get, I think a better working cadence, but I would say it's huge success in terms of ability to scale it. Second, I would say, as I think about it, I'm a clinician, I think about it in terms of the clinical model. We've really been able to demonstrate a new care model, right, which is about an integrated pharmacist, physician, interdisciplinary team working together, looking at the patient holistically, whole person care. And as I think about success in that context, there's a lot of work that our pharmacists and the team at Village is doing together around, I would say, one, having more data availability and visibility. So when someone is, uses multiple pharmacies or has multiple medications, the ability for the physician to then be able to, refer them to the pharmacist as part of that team to be able to outreach and engage with them. That's, I would say clinically, that's a success. We're seeing great metrics in terms of adherence, ability to close the gap in terms of someone being adherent to their medications. We've got collaborative practice agreements under the physicians to be able to do more, like, filling prescriptions, prior authorization. So I think about clinically this model around really bringing together the pharmacists in a key way, in a key role, that's success. And then I'll say, and we're starting to see that in many metrics, whether it's, annual savings for MA patients, medication adherence, hospital readmissions, emergency room department avoidance. So across clinical metrics, across operational financial metrics. And then I'll end with sort of really the important one is our pharmacists, our team members really enjoy this, and from a patient experience. And for us, and Mark knows this, we're very much about the patient experience. I'm going to read an example of something that came directly from someone This is a patient from VillageMD who said, I've had type 1 diabetes all my life. And between that and all the other complications as I've gotten older, just keeping my medication straight has been a burden. It's great to see a pharmacy and a physician's office working together like this. So that's an example. And we have so many more of these where patients really appreciate the opportunity to go see their physician, walk out, be able to go in and get their medications in the pharmacy and know that the teams are really collaborating together and helping both from a condition management as well as from a financial and trying to give them optionality. So I would say definitely, great success across all of those three dimensions I mentioned.
There's some very interesting, some of what you're saying, in that the synergies you're getting from the co-location of a primary care practice and a pharmacy are, it sounds like, go much deeper than just, hey, nice to see you, patient, blah, blah, blah. I'm writing you a prescription, just go next door and get it. It sounds like there's, on the back end, you were using words, phrases like care team involving the pharmacist and sharing of information. And I'd love to understand a little bit more about that, because that really isn't how most, almost all of healthcare doesn't operate that way today. They're very separate and very siloed. And how are you actually doing that from both a kind of process point of view and also from a technology point of view? And Anita, would maybe start with you, but would welcome both of your perspectives on that.
Yeah, definitely. I'll kick it off and Mark can certainly add to it. And I think, as you said, what are some of the challenges? I would say one of the challenges people don't recognize how truly, almost integrated, and I use integrated as how much of a team approach this is. Because to your point, Stephen, it's not just, hey, I'm walking in and it's convenient. It really is, how are we building the infrastructure to enable it? Some of the examples I'll give you is our pharmacists, not all the pharmacists, but the pharmacists who are working in this collaborative arrangement have the ability to see the patient's EMR record. So imagine, typically, if you're a pharmacist within a pharmacy, you don't have the ability to see, all the other conditions someone has. You have hypotheses and algorithms based on the medications they're taking, and most times it's pretty good, but you don't have the ability to see the lab results and all that. So now you've got this rich information, because we've created that connection point into being able to see that. And on the other side, the physician and the Village team now has the ability to see if someone's actually taking their medication or not. Typically, if you're a physician, you write the script, the patient leaves, and then you ask, it's self-report, have you been taking your medication? But you don't have the ability to actually see, are they taking it? Are they non-adherent? And so now they have that data and that information available. So just that's one example of sharing information. So you're really able to look at holistically the entire profile. Mark, any other examples?
And I think that's exactly right, Anita. And I would just add, one of the things that connected with me when we were first starting down this journey, you look at all the different models in healthcare, and whether it's payer-led, technology-led, whatever, everybody's looking for that access point to the patient so that they can engage with the patient and drive change at the point of care. A lot of the problems in our healthcare system are come down to patient behavior, compliance, adherence, those kinds of things. And what was always interesting about the care delivery, the primary care, whatever form of care, ultimately we at Walgreens believe, there are a lot of great models, a lot of great care delivery systems. Primary care was the right place for us to start when I was on the Walgreens side. But if you think about a primary care, even a very active primary care patient relationship, 3 or 4 visits a year. An active pharmacy and a pharmacist patient relationship is 12, 13, 14 times a year. So if you can take all of those patient interactions and have the pharmacist talking to the provider, supplemented by the technology and the investments in the data and the other resources that a company like Walgreens has the ability to build out, it's a really powerful set of tools that you have to engage with the patient in a way that that patient's never experienced, and really can have an impact on that patient's life and drive a better outcome and a better experience for that patient. So we at Village, and I'm putting Village, I think no better entry point into the healthcare system than the primary care physician. Having that entry point sort of covered or wrapped around with a very supportive pharmacy partner, and broader than pharmacy partner, driving integration beyond just what people think of when they think of pharmacy. It really differentiates our model and allows us to deliver a better experience, make the physician's life easier so that they can take better care of the patient, and the patient can get to us easier and take better care of themselves. So we really do think there's power in those touch points and power in that integration. And I would just, a lot of people aren't familiar, because we're still a small company, and we, as Anita said, we only have 200 of these installations. But if you're in Phoenix, Houston, many markets in Florida, Atlanta, increasing in the Northeast, we're around. And if you have an opportunity to see our clinics inside Walgreens, they're the most beautiful primary care clinics you'll ever see. They're not anyone who has a 10 by 10 box in the back of a retail store, like that's not what this is. This is state of the art, really innovative, beautiful stores, great patient experience, great provider experience, really collaborative environment in the clinic itself. There's a door where the pharmacist and the doctor connect, the very easy access for the consumer to both sides. But you don't really know what it looks like till you're in it, and once you're in it, you're like, wow, these things are awesome. So I do encourage you to go see one of these clinics if you have an opportunity. There'll be a lot more coming, but for now, if you're in particularly Phoenix or Houston or some of the Florida markets, that's where you'll have your best bet.
Well, during the pandemic, I've spent 4 or 5 times visited the 10 by 10 boxes in the back of a Walgreens, and glad that the experience that you're creating is a different a different kind of an experience than.
And we need those. They're great. It's not criticizing other models. I'm just plugging ours. I think ours is really, and it's ours together. It's the Walgreens experience inside the you walk to the right, you see Village, to the left you're in Walgreens, you walk out the back of Village, you're back in Walgreens. It's really it's just a great experience.
Yeah, and I would add, Mark, I think to your point, and Stephen, what you've experienced, I think in some markets, in some stores, you need that little, almost small box environment, right? You're going in, you want a private vaccination or some other testing. And that need does not go away. But to Mark's point, in some of these stores, if you go in and nobody believes it until they actually walk in, where you have, 4, 5, 6 exam rooms, physicians, phlebotomy. It is like walking into a state-of-the-art primary care clinic, and everyone thinks about the small space where you're cramped and maybe you'll get a blood pressure reading, and it is way more than that, I would say.
So pharmacists, traditionally aren't doing a lot of what it is that you're describing them doing, and having access to that kind of information, having sort of a richer, more nuanced type of a conversation with the patients, how are they reacting? Is this something that Anita, the pharmacists, the population who you're working with, excited about this? Are they sort of like, oh gosh, now I have more stuff I need to do and more things I need to read and more expectations? Or are they excited about it, that this is I can really dig in more to care, which I love, and get to know patients? How does that, just sort of culturally and from the human perspective, how does that go?
Yeah, listen, what I can tell you is the vast majority of the reason why pharmacists went to pharmacy school is to have this type of experience, right? Have the dialogue, really focus on your patient, meaningful ability to change the trajectory of their care. And so I would say the ability to do this, I mean, as in any profession, you have some people who say, no, that's not me, I don't want to do it. But us really moving into aspects of pharmacy beyond dispensing, really in clinical patient care is something that I would say the vast majority of pharmacists really embrace. And you know, frankly, and as an organization, what we've also done is it's hard to say, hey, do all of this when you're working in a very, very busy pharmacy. So we had to think about what are the tools and technology and ways of working to enable pharmacists to have more time to in fact do that. And so we've rolled out automation. We've got micro fulfillment centers where we're actually taking a lot of the labor from the stores out. And so the pharmacist can focus on these types of interactions, whether it's through Village or in standalone locations. Even if we don't have Village, you'll see our pharmacists do these types of clinical interventions like medication adherence, trying to close gaps in care and therapy. So I would say, to answer your question, yes, it's really, as a profession, welcoming to be able to do it. And as a company, we are making sure that both in terms of technology and training, we're giving them time and the skill sets to be able to do it.
Anything more specific you can say about the technology? It's, you know, near and dear to our community at Matter, and a lot of the people who are going to be listening to this and watching this. Are there other areas you can, or what else can you say about the kinds of technologies that you've implemented? What's, you know, have you had to build a lot of stuff? Is it just simply giving access? You know, the pharmacist gets access to the electronic medical record. Is there some intelligence underneath to surface kind of relevant insights from the clinical data that have to do with the medications they're prescribing? Or just talk a little bit about how that's going. Again, I'd love both your perspectives on that.
Yeah, I would say, you know, I'll start off, but, you know, the term technology is so broad around what we can do. So I'll hit on a few things. One is, as I mentioned, you know, just automation and removing some of the more, you know, I would say, prescriptions that can be filled elsewhere and then back to the store. So that's one, right? You're taking out, so the pharmacists don't have to. I would say embedding the ability to see EMR records when we're working with Village that has underlying clinical decision support, has predictive algorithms and models to really be able to identify when there is a problem, what's the most critical issue, how do you tackle it? So I would say definitely building in clinical infrastructure, clinical algorithms, and AI into both the standalone, what the pharmacist can do, as well as in our collaboration with Village as an example. I would say we've also invested a lot in our digital capabilities, and a lot of that was accelerated during the pandemic. So the ability for our consumers and patients to just go on My Walgreens, the app, and be able to find care, be able to actually schedule appointments as needed, you know, whether it's testing, all of that. So I would say it's been across the board, multiple facets of operational automation, clinical workflow, decision support, consumer-facing digital tools that make it really easy to connect into care as well.
Mark, anything to add on the technology?
Yeah. Well, I think Anita is far more proficient in this area than I am, and she described it as, you know, there is you know, all the elements of incremental, you know, enriching our respective insights into each other's business so that in legally permissible and regulatory permissible ways to drive better patient experience. There's also sort of a capital element to the technology. Is, you know, we referred to our 200 co-locations. We also have, you know, hundreds of clinics that are not within a Walgreens pharmacy, and we want to be able to drive to all of those patients and benefits that they would get through the integration and the enriched care model that we have by working with the Walgreens pharmacy. And technology will enable that in a more efficient way than building a pharmacy inside of every one of those clinics, or, you know, making patients go from, drive 3 miles down or we can't direct patients do anything, but suggesting the patients to get the benefits of this pharmacy integration, you could drive a few miles. And we're hopeful, and we're working on investments now in ways to closer connect and drive that pharmacy integration with technology, even in areas where we don't have brick and mortar co-location. So that virtual integration, or that delivery back end, or that sort of a virtual care team that includes a pharmacist that's a market leader that will support these locations that aren't built inside a pharmacy.
It's a really interesting, a very interesting model. So going to the next step, I guess, you got primary care, you've got pharmacy. Obviously, healthcare encompasses a whole variety of other specialty services, and how do you today coordinate, if at all, with all of the other aspects of healthcare that a patient may need? And then how do you see that evolving? And do you see this collaboration? Anita, do you see Walgreens kind of moving more into other services beyond primary care and pharmacy? And what does that look like today? Where's it going?
Yeah, Mark, I can go, but if you want to start with how Village is thinking about expansion,
Sure. Yeah, I think similar to what I was saying before, when I joined Walgreens in 2005, it was about, I went there to buy 1 or 2 pharmacies, and I quickly found out that it was much bigger than that. We were building an incredible foundation upon which we could build services. I think Village is in that building the foundation phase, and we have a great market position in about 25 markets. We're growing in all those markets. There's a lot of room still to grow, but then there's hundreds of other markets that we still need to find the right entry point, whether it's organic, inorganic, what have you, and prioritize those markets. So we have our founder, Tim Berry, one of our 3 founders, our current CEO, always says, we're 9 years in as a company. He's like, where are you 9 years in? It's like, well, 9 years on a 100-year journey. Where this is a long push for us to really bring the right kind of care to the people in this country who need it. So we'll be focused on building our foundation. You're absolutely right. That doesn't mean that we're to confine our model into primary care, internal medicine, family medicine. That is the entry point into a much broader system. And as our presence, we will expand as much as possible in the markets that we can. We'll do everything we have a right to do that'll drive a better outcome for within the, as we build the foundation in the market, in a market like Houston, Phoenix, where we have a significant presence and have market relevance. We'll start to expand the scope of care that we manage and drive better results along a broader continuum, whether it's in some of the specialties or ancillaries, or other sort of layers of the healthcare system to drive better outcomes and value. And then while we're doing that, we'll also continue to focus on our core, let's build the foundation across other markets, expand our clinic presence, aggregate lives that our providers can treat. So it's a build the foundation, strengthen the foundation, and integrate with the rest of the continuum to drive better value, making healthcare more affordable, accessible, higher quality, and better outcomes. All the catchwords.
Yeah, and
we can do it. We can do it because we are the entry point and we are the people taking. It's much easier for the care provider than the non-provider. I won't to actually deliver the outcomes. That's what's the magic of our model.
Yeah, and I would say ours is, I said this when we started, definitely, primary care is important. I've talked about our capabilities in post-acute and home benefit navigation through CareCentrix. We do think, as you think about, primary care is the anchor, but lots of costs in specialty conditions, obviously. we will partner with specialty organizations to help drive, very similar to what we're doing with Village, where we can, again, be an extension, where we can, through our footprint and our capabilities, be serving those patients in a different way, in a very localized way. That's also an opportunity. Again, we don't need to necessarily own all of these. We really believe in strategic partnerships. So across the board, as you think about where some of the costs might be, we definitely are looking at collaborations in, mental and behavioral health with leading providers. How can our footprint become an extension there? How do we work with cardiovascular physicians, again, as patients are in our pharmacies or in our virtual channels? So definitely that area, both through Village as well as other providers, you'll see us have partnerships. And then I mentioned home is important, whether it's a combination of our existing capabilities or technology capabilities to enable care delivery at home. That's also another area. So absolutely, I would say this is a big part of our strategy, but we will continue to think about other capabilities and services across that entire continuum.
It's very clear from everything you're saying and from the moves that Walgreens has been making lately that the company is very committed to being a healthcare company, which has not been the case for, we've seen other companies kind of dipping their toes, CVS, Walmart, and there was a question of whether, which path is Walgreens going to go down? It seems very clear that Walgreens is firmly committed to being a healthcare company. You've said you're planning, I believe, to locate 1,000. I think that's what you've said publicly. 1,000 clinics in the next few years. So one, is that right? And two, are those going to be concentrated with, there's 25 in certain markets, or is this a national strategy? Are you looking at rural as well as urban? Can you talk a little bit about where we're going to see these?
You want me to take that? Yeah. I think, we at Village are going to, build as many clinics as we need to take care of the people who need care and are appropriate. We will be in medically underserved area. One of the defining principles of the partnership was a joint commitment from both Village and Walgreens to serve medically underserved areas, and we think they're working with governments and payers to create the right circumstances so that can happen, and can happen in a way that we're all properly incented, and that is, I think you can put that down as a certainty that we'll expand in those areas. We, in terms of, I think the number that you threw out was, will we have how many clinics and over what period? I think we'll continue to build more than, we'll end up with more clinics. We're testing formats all the time, whether it's one large format, one medium format, whether you acquire and build a Walgreens pharmacy inside that, or you continue with the 3,000 square feet inside the Walgreens, like the 200 that we had. And we will absolutely continue that model. We love that model. We'll supplement it with other models, and we'll end up with a much bigger footprint than any other provider in America. I think we're very early in the journey. Whether we get back to your questions on technology, when we think of integrated clinics, we think of both co-located and virtually integrated and technology integrated. So exactly how our footprint evolves, 1 year in, I'm sorry, 2 years in, that's all. We're working on the final answer, but it's going to be a very big footprint across a lot of markets, very soon, and we're continuing to build very aggressively. We're very much like the model. Want to make sure that we adjust it and are deliberate and building the best model and learn integrate those learnings as we can to bring a solution as broadly as we can bring it, and as effectively as we can bring it.
Anything else that either of you would like to add or make sure that people know about this collaboration and where you're headed and the future of primary care before we wrap things up? I have thought for a while that VillageMD was one of the more interesting companies in healthcare based on the approach and what you're doing, and I think this collaboration has really the potential to evolve primary care and evolve healthcare, is sort of hinted around a little bit, in ways that few of the collaborations or initiatives that are out there in the country today really have. So I'm very excited about seeing what comes next. And if you have any final words for the audience, I'll Anita, and then Mark, I'll let you do
No,
that.
thanks for the time. What I would say is, as we think, and Mark talked about where we will be a few years from now down the line, I do think one of the important things has been that, we've been pretty culturally aligned about what are the important things as we think about this collaboration and the issues Mark said, right? It's about access, it's about convenience, it's about serving everyone. We firmly believe, being payer agnostic, taking care of all patients, not just certain segments of it, ensuring that we're really in medically underserved areas and addressing the issues of health equity. All of those are really important as you think about how you bring these partnerships together. And that alignment is very helpful. So I would say, more to come. What will be really important is we will have 200 that we learn from that. In some areas, patients may say they like that experience. They may not like it, right? To be agile, to get those learnings and pivot and change models as we evolve and keep ahead of the market and making sure that we're really addressing patient and provider and clinician needs is critical for us. So what today looks like will look very different than 3-5 years down the line, but really optimistic about the outcomes that we can yield here together.
Yeah, no, and I would just echo that, thank you personally, Anita, for the partnership. You work hard, very hard to make this real, and everyone on the Village side appreciates that. It is, there's an unlimited potential to, what we can do. And I think, Stephen, I appreciate your comments about the opportunity Village has. I share that view. I really think we can do something special here, and the Walgreens partnership is a major enablement of that, of whether or not we'll be able to do that. So I think it's all around very, very positive for both organizations, and it'll just get more positive as we get further along.
Well, thank you so much, both of you, for joining us. Really appreciate it. Really appreciate your perspective. Again, really looking forward to seeing how this collaboration evolved. Thank you to everyone for joining us. I hope that all of you enjoy the rest of